Welcome back. Today we're doing a deep dive into blood pressure variability. It's that really common question of why your reading is never the same twice. Your sources laid out some fantastic data on what's normal, so our mission here is to really cut through the noise so you know what's worth paying attention to.
And we have to establish this right up front. The key premise is that blood pressure is not a static number. Fluctuation is completely physiological. It's supposed to happen.
So it's not a sign that something's wrong, necessarily.
Not at all. In fact, we have hard data on what's normal.
Mm.
A huge American Heart Association study, we're talking over 23,000 adults, found that typical long-term variability is around 11 to 12 millihg for
That's
systolic.
the top number.
The top number, right. And about 6 to 7 millihg for the diastolic. That's really your baseline window of expected change. And what's really interesting is how scientists categorize this. Research confirms there are basically 4 distinct types of this natural fluctuation. First, you have the really fast beat-to-beat variability. That's often just tied to your breathing cycle. Then there's the diurnal cycle. That's a 24-hour pattern.
Higher during the day, lower at night.
Exactly. It dips while you sleep. Then you've got day-to-day variability, say, over a week. And finally, there's visit-to-visit, which is measured over months or even years during clinic appointments.
So given those 4 beat-to-beat, diurnal, day-to-day, and visit-to-visit, it seems like moderate fluctuation is just expected. But your sources also say that excessive variability is a problem.
That's the critical point. A little change is normal, but big swings, well, those are strongly associated with higher cardiovascular risk.
And that's why the hospital data is so reliable, right? Because the nurses are following such strict protocols for measurement.
Precisely. Standardization is key. Which brings us to a really common scenario, the urgent care visit.
Right. Why does that single reading we get at urgent care almost always seem to be so high?
Well, it really boils down to situational factors. The readings are often falsely elevated because of temporary causes.
Like pain or just being anxious about being there?
Yes, pain, anxiety, that classic white coat syndrome, but also things like rushing to the appointment, maybe being a bit dehydrated, or even just a simple technical error.
An improper cuff size or
A
something.
huge one, or not having you rest for 5 minutes beforehand. It all adds up.
Okay, so let's unpack the implication here. One high reading, especially in a stressful place like that, is not nearly enough to diagnose hypertension.
Not even close.
So what is the safest way to follow up then?
Confirmation has to come from evidence-based monitoring at home. Clinicians will usually recommend 2 or 3 readings a day. The question is for how long.
Right.
A 3-day log can be a useful quick check, especially if that reading was very high or you had symptoms, like a headache or dizziness.
But that's not the standard.
No. The preferred standard is the 7-day follow-up. A full week really smooths out that day-to-day noise and gives a much more accurate average for a diagnosis.
And this focus on monitoring, it speaks to why doctors are so cautious about treatment in urgent care. They don't just jump on a high number with medication.
You can't. Because lowering blood pressure too fast in someone whose body is used to it being high, that's dangerous. You risk reducing blood flow to vital organs.
The brain, the heart, the kidneys.
All of them. You could cause ischemia or serious injury. That's why we distinguish between a hypertensive emergency and a hypertensive urgency.
What's the difference there?
An emergency means your BP is sky high. Think over 180, 120, and there's active organ damage happening. That requires controlled, rapid lowering in a hospital.
An urgency.
Urgency is that same high BP, but without the organ damage. And that requires slow, careful treatment over hours or even days. It reinforces the whole monitor-first strategy.
So to bring it all home for you, the listener, the safest strategy is always confirmation with home monitoring. It prevents you from getting put on long-term medication you might not need. Treatment decisions really depend on your average home BP, your symptoms, and all your other risk factors, not just that one spike at the clinic.
And here's a final thought to leave you with. We talk about the body's variability, but medication has it too. Many common drugs, like ACE inhibitors, are designed to last 24 hours. But not all of them do. Some older ones might require dosing every 12 hours. You should always confirm the specific duration of your own medication with your doctor, because managing that timing is just as crucial as tracking your body's natural rhythms.